why we need comprehensive national healthcare reform. Healthcare reform, now dominating center stage in the news and politically, is far from new. While much of the world, particularly Europe, has offered free, state-run healthcare for all for generations, our concept of modern health insurance only began to evolve less than 100 years ago. As early as 1912, President Theodore Roosevelt campaigned promising national health insurance, citing Germany's success with old age pensions. The cries of socialism we hear today from critics of healthcare reform are not new. They started as early as the 1930s, when the American Medical Association objected to calls for group insurance by the Wilber Commission. After slow improvement in coverage, and again over the protests of the AMA and other organizations, Medicare and Medicaid were born on July 31, 1965, ensuring medical care for the elderly and indigent. But just as the AMA has fought healthcare reform for decades, special interest groups have as well, including at town hall meetings with members of Congress 30 years ago, leading to the repeal of the just passed Catastrophic Coverage Act. Does this sound familiar? So, where are we with universal health care now? First, the myths. Myth 1. The U.S. has the best healthcare system in the world. Truth. While our technology and medical expertise are world-class, the results are far from it, as we trail many countries in metrics from infant mortality to life expectancy to immunization rate, where we trail number 66, Botswana. Myth 2. Universal healthcare is too expensive. Truth. We already spend considerably more per person than any other industrialized country with a single-payer system. Savings achieved by significantly reducing the huge administrative costs of our current system would be spent on providing care instead. Myth 3. Universal healthcare would restrict access to needed services. Truth. Under our current system, even the best insured can only go to doctors and facilities pre-approved by insurance companies. Myth 4. Universal healthcare is socialized medicine. Truth. Universal coverage is single payer, not single provider. Besides, very few argue against public funding of other critical functions like K-12 education or national defense. Myth 5. Emergency rooms are a safety net for the uninsured and illegal immigrants. Truth. Emergency room care, as expensive as it is, only requires stabilizing the patient and does not provide ongoing treatment or preventative care. And yet one more myth. Private industry and the invisible hand of the market always find the best solution. Seriously, how has this worked out for many Americans for the past 75 years? So if single-payer, universal healthcare is better, why don't we have it already? Quite simply, inertia and a huge amount of money that the corporations and lobbyists spend on influencing Congress has exceeded the desire and efforts of real people to achieve meaningful reform. So what do? Draft, fight for, and pass comprehensive healthcare reform legislation that includes a single-payer provision. The need is now. According to the U.S. Census Bureau, nearly 47 million Americans, a full 20% of people under 65, were without health coverage in 2008, and the current recession is expected to cause 7 million more to join the ranks of the uninsured by 2010. As many as 66 million will be without health insurance by 2019 if current trends continue. Healthcare expenditures comprise close to 18% of our total economy in 2008. Forecasts are for it to continue to grow at an increasing rate, which is unsustainable, according to numerous economists and the Congressional Budget Office. The number one cause of personal bankruptcy in the United States is unpaid medical bills. Rising premiums are the top reason small firms don't offer employee coverage. Even the insured are uninsured. Consider the case of Robin Beaton, who was denied coverage for a double mastectomy when her insurance company, facing a large claim, investigated and found that she forgot to declare a case of acne. Studies estimate that as many as 22,000 Americans die each year due to lack of insurance. To put that in perspective, that's almost half the number of Americans who died in the Vietnam War. over 15 times the number of Louisiana residents killed by Katrina in 2005, and about 7 times the number of Americans killed on 9/11. Those in power for most of the last 30 years had their chance, and healthcare is a bigger mess and a bigger issue now than ever. Albert Einstein is credited as saying insanity is doing the same thing over and over again, expecting a different result. What are we waiting for? Pass comprehensive healthcare reform now.